A very good day to everyone. Welcome to our webinar on a definitive guide on billing and payments for telemedicine. My name is Diya Ranjan. I'm the marketing manager at Bizmatics and the organizer for today's webinar. And it's a pleasure for me to introduce our two panelists for today. Uh, Joining me today on this webinar are Kristen Neck and Stephanie Bulgarino. Kristen is the Vice President RCM Services at Bizmatics. She has 20 plus years of experience in billing and healthcare management, and her experience and expertise allows her to guide and provide valuable feedbacks to practices. Our next presenter is Stephanie Bulgarino. She also has 20 plus years of experience in revenue cycle management. And prior to joining Bizmatics, she was Vice President Revenue Cycle Management at Integrated Management Solutions and Integrated Pain Solutions. So welcome to both of you, Kristen and Stephanie. And before we move ahead, all of us at Bizmatics would like to applaud and thank each one of you for being at the forefront of healthcare now when it is most required, and for working so hard to build a healthy and safe community. We really want to tell you that we stand with you and are there to help you at every step of the way. We will go ahead. I just wanted to let you know that in case you want to access the webinar later on, the recording will be available in our resource center. So just let's move ahead and welcome to my presenters, and over to you now, Kristen.
Thank you, Dia. So to start, I wanted to go over the types of telehealth. There's three main types. One is live video conferencing. Zoom is an example of this. Asynchronous video, or AKA store and forward videos. Those are where a patient will take a video of an issue and send it to the provider through a portal. The provider then watches the video and sends a message back to the patient. And then remote patient monitoring. The eligible providers for these services are physicians, nurse practitioners, physician's assistants, clinical nurse specialists, psychologists, social workers, and dietitians. For psychologists, instead of telehealth, it's called telepsychiatry, and it's also covered, but the guidelines might be slightly different than what we're going over today. So if you have additional questions about telepsychiatry, there are links provided in the webinar at the end that can help you with that. In 2020, there were three new codes introduced for telehealth. It's 99421 to 99423. These codes are cumulative codes, and they can be billed up to 7 days. What that means is it's an evaluation and management service for an established patient only. And most of this communication is done online through email, the patient portal. It may involve a phone conversation, and the provider can add up the time throughout the week and then bill. This slide goes over that in more detail. Again, the patient has to be established. It has to be done by a physician or other qualified healthcare professional. And the communication is done online, telephone, email, or digitally supported communication. Most telemedicine is billed with CPT codes 99201 to 99215 with one of the corresponding modifiers. Medicare does not require a modifier, but they do require the place of service O2. O2 was recently introduced, and it stands for telehealth. Some of your other payers, example Blue Cross Blue Shield of North Carolina, are requiring modifier CR for audio-only visits, and modifier CR is defined differently between some commercial payers and Medicare. Medicare defines it as an item or service that is impacted by an emergency or disaster, and Blue Cross Blue Shield of North Carolina defines it as an audio-only visit during a catastrophe or disaster. Most providers are going to use modifier 95, which is the synchronous telemedicine, which means that it's an interactive video. When you're billing the new codes, 99421 to 99423, there are certain rules that apply. Example, you can only do it once in a 7-day period. You cannot report it with an E&M. And you do not want to report it for home or outpatient INR monitoring when reporting the other codes. Phone consults. So 99441 to 99443 are still active codes, but not all payers reimburse for this code. However, we are in a state of emergency, and a lot of the payers have changed their rules regarding audio-only calls. You'll want to go to that payer's website and pull up their guidelines. An example, Medicaid of Texas is allowing audio only, and you would still bill it with a 99213. Store and forward, Medicare has a code for that, G2010. That code specifically says that it was a recorded video and or images that were submitted by an established patient. It can only be an established patient. And the provider analyzed the video or the images and treated the patient based on that. With the store and forward, you have to make sure, again, it's an established patient and informed consent is required still. As well, if the patient has to be brought in based on the photo for an E&M service, you cannot bill the G2010. How do you set up your claims? 1, you want to make sure you have a location set up with place of service 2. And you want to make sure you have an encounter type set up for telemedicine. Within Prognosis, after you turn on your telemedicine, you'll notice that on your encounter types, you'll have a checkbox now that says telemedicine appointment. You'll want to make sure you check that. And you'll also want to make sure for your location, you have place of service 02 set up. The address that's going to go in box 32 will be where the provider's located. This is a sample CMS. It does include the place of service 2, your E&M code, and on this particular sample, there is no modifier required. Let's talk about your progress notes. First, you want to make sure that you have a statement at the very beginning that indicates that the service was performed via telehealth. You'll also want to indicate the location of the patient. For example, the patient's at home. Indicate the time spent with the patient at the end of your progress note, and ensure that you're still documenting a physical exam when medically necessary. You'll also want to make sure you don't under-document because it's a telemedicine visit. You still want to use your templates as normal, document your HPIs, review systems, and when applicable, have the patient do an examination. They can stand up in the video, they can do range of motion in the video where the doctor can see. You can have them bend over, and there's many things you can do over the video, even if you yourself cannot perform it. You'll want to make sure that the services you are providing allow you to give an informed diagnosis to the patient. Some providers, when the patient goes onto their portal to log into the visit or schedule an appointment, will ask a series of questions to make sure that they don't need to be seen in person. You'll want to set up which services will require them to come in person versus which ones can be done over the Zoom app. Some examples are allergies can be treated over telemedicine, cold and flu symptoms, diarrhea, insect bites, rashes, vomiting. You can do post-operation check-ins and more. Can you see a new patient via telemedicine? All states have different guidelines on establishing a patient relationship via telemedicine. You will want to make sure that your state allows it and what specifications they have in place for it. There is a link on this webinar or on our slides that will link you to AMA's state guide so you can check if your state allows it or not. An example of one state allows a distant site provider to utilize telehealth to establish a provider-patient relationship, but they have to be able to ensure that the patient is in fact the person he or she claims to be, and they have to be able to establish a diagnosis through the use of acceptable medical practices, including patient history, an appropriate physical exam, and diagnostic studies. And you'll want to make sure there's availability or appropriate coverage of the patient for follow-up care. So you'll want to make sure the patient's able to come to your office if necessary for a follow-up. Payer-specific guidelines. Right now, because we're in the middle of COVID-19, a lot of payers have changed or relaxed their guidelines. An example is Medicare. Typically, Medicare has a lot of rules and regulations when it comes to who can see patients via telemedicine. On March 17th, that was lifted with the address from President Trump, indicating that all patients could be treated over telemedicine right now. Again, Blue Cross Blue Shield varies by state on if they're allowing this. TRICARE does allow it as long as you follow the same referral and pre-auth guidelines as if they were coming in person. Humana, Aetna, Cigna, and United Healthcare, they've all also updated their payer sites. You'll want to go on to the payer website and just check and see what their guidelines have been updated to. And Medicaid is state specific as well. Most of this information you can find online. Again, I would recommend going to the payer websites over calling right now. They all have information on the telemedicine listed for you. Does your state allow telemedicine? Not every state allows it. Again, you're going to want to go onto your site-specific website and see if they do allow it. We've provided a link here for you. You can click it, click on your state, and you'll be able to pull up information on it. Again, some states may have allowed it during the state of emergency, so make sure you're checking that before providing the services. Stephanie?
Hello. Hi, everybody. Thank you for joining us today. My name is Stephanie Bulgarino, and as Dia had mentioned, I'm a senior manager of RCM services. I've been in healthcare for over 20 years and working with prognosis for over 8 years. Also, I'm recently employed by Bismatics. So today, I would like to talk to you about e-prescribing controlled substances via telemedicine. As you may know, under normal conditions, you can't e-prescribe controlled substances through telemedicine. But while the public health emergency for COVID-19 is in effect, DEA-registered practitioners may issue prescriptions for controlled substances to patients they haven't conducted an in-person medical evaluation, providing all the following conditions listed here are met. A prescription is issued for a legitimate medical purpose, the use of appropriate telemedicine communication system, and the practitioner is following federal and state law. I would also like to mention the DEA has posted information on its website stating that it will not enforce restrictions on prescribing controlled substances via telemedicine during the national state of emergency related to COVID-19. Next slide. You may be wondering, how do I know if my state will allow me to e-prescribe controlled substances? Well, each state's rules regarding e-prescribing via telemedicine are different and changing while the public health emergency is in effect. We recommend you contact your state medical board to find out what their position is at this time. Some state medical boards are posting this information on their websites, so I would start there. Next slide. One more thing to consider when implementing telemedicine is informed patient consent. Some states may not require informed patient consent, but it is recommended as a best practice. Here we have examples of what you should include on your consent. We've also included a link on the resource page to check the requirements for your state. Next slide. Here's a list of the resources that can provide more detail of the things we've discussed today. That's all I have today for you.
Thank you so much, Kristen and Stephanie, for this wonderful, insightful session on billing and payments in regards to telemedicine. Telehealth has really been revamping the healthcare delivery model in the current COVID situation. And I hope that today's webinar will help all our attendees and provide them with all the needful information they need to make decisions. So, as I mentioned earlier, a recording of this webinar will be available in our resource center for future reference. And you will also have access to our question and answers and a PowerPoint slide PDF, which you can use for your future reference. So thank you again to my presenters, Kristen and Stephanie, and bye from all of us from Bismatics. Thank you.
Thank you.